afford prescription medications can also turn to several supportive programs right here in Virginia. I am delighted that Delegate Phil Hamilton from Newport News is with us to discuss them. Delegate Hamilton is a 20-year veteran of Virginia's House of Delegates and known for his expertise in health care and financing. He is chairman of the Health, Welfare, and Institutions Committee and vice chairman of the House Appropriations Committee. He has also served on the legislature's Joint Commission on Healthcare for years and is currently its vice chairman. Delegate Hamilton has been a leader in the state's efforts to support several innovative medication assistance programs. Welcome, Delegate Hamilton.
Thank you, Debbie. It's a pleasure to be here.
We're delighted to have you. Tell me, with your 20 years in the General Assembly and all of your expertise in healthcare, what's the value and importance of prescription medicine?
I'll tell you, Debbie, it's critical. Prescription medications are what help people to exist productively in our society. And if we didn't have the prescription medications available to them, so many of them would be missing time from work, missing time from school, oftentimes having to visit the emergency room to get the care that they need. So being able to have those prescription medications available is a tremendous asset, and Virginia has a lot to be proud of.
So you've been very involved in a special initiative, the Patient Advocate Foundation. And why don't you tell us about some of the good work that it does?
Well, the Patient Advocate Foundation is an organization that started in Newport News in 1996. And it started primarily as an organization to help individuals with cancer who maybe didn't have insurance or their insurance wasn't going to cover this treatment or that treatment. And so they really have become an outstanding advocacy group for those citizens that need help navigating the web we call healthcare here in America. And several years ago, they expressed an interest in working with uninsured patients on things other than cancer. So in partnership with the Commonwealth of Virginia, they actually implement something called the Virginia Cares Uninsured Program. They've served nearly 1,200 individuals since it started July 1st of 2007. Just in the first quarter of this year, they've seen nearly 200 Virginia citizens from across the state, helping them to get whatever types of health care services they need, because these are individuals that are uninsured. It's a tremendous organization, does great work throughout the Commonwealth of Virginia, and because we have a growing number of uninsured citizens in this day and age, organizations like the HealthCare Foundation, the Patient Advocate Foundation, really do provide a great service to so many.
I think, if I'm remembering correctly, one of the services that the Patient Advocate Foundation provides also can help people who are insured but who can't make their co-payments.
They assist with co-payment insurance. They oftentimes, an individual with insurance, they have used up all of their insurance benefits. And the Patient Advocate Foundation does a good job in sometimes getting these folks into clinical trials so that they get the health care service they need, even though they themselves may not have the financial resources to pay for it, or that their insurance no longer is going to cover what services they actually need to have.
So it's a wide range of offers of services and help that they provide. While we're talking, we're actually showing on the screen their website and an 800 number and how to get a hold of them.
Well, I'm proud because they're a national organization, and their home base is right in Newport News. So it's a wonderful organization that does great work, like many organizations throughout the Commonwealth.
You've also been a big supporter of RX Relief Virginia, a special partnership between the Commonwealth and the Virginia Healthcare Foundation. Tell us a little bit about that program and its value. It's
just another one of the wonderful programs we have in Virginia, where for a little bit of money, we're able to access a lot of prescription medications. I think most recently $1.2 million investment, and that's generated nearly $29 million in prescription medications. Again, it's the lifeblood of our free clinics and community health centers, who without this type of assistance wouldn't be able to have the medications available to help the citizens that they serve. So Virginia has a lot to be proud of when it comes to these types of nonprofit organizations working together, trying to leverage the limited dollars that we have to maximize the benefit for those in need.
I think we have about 42 medication assistance caseworkers currently employed through the RX Relief Virginia initiative, serving something like 68 localities. So people around the state can really get the help they need.
And I think that's what we've done a good job doing. I know Patient Advocate Foundation has gone across the state doing seminars and making people aware of the services they provide. And again, the HealthCare Foundation has been doing that for over 15 years now. It really is important because so much of it is educating the public about the types of services that are available.
And in all of these, the medications are free. And that's really important for those who have chronic illnesses and incomes typically about 200% of poverty or below.
Right.
That brings us to the economy and the financial duress that it is currently experiencing and that so many are currently experiencing. You've been at this a long time, 20 years in the
Right. General
General Assembly. Any thoughts in terms of what it means for health care and
one
needs?
of the things we know is that in down times in the economy, people have to make tough choices, and it is do I pay for shelter? Do I pay for food? Do I pay for medications? And oftentimes the health care is the one component that they'll say, well, yeah, I may not feel real good today, but I'll feel better tomorrow. And so oftentimes health care goes wanting. And so any time that there's a down economy, that's what we tend to see. Health and human resource needs go up, social service needs go up. Fortunately, the economy has been cyclical, and while we're in a downturn, we can all hope that it won't be a very deep or long downturn, and the economy will turn back around. But it's more important than ever to make sure that we've got the infrastructure in place to help these folks, because when people are hurting, they'll get coverage. They'll go to an emergency room. Emergency rooms, unfortunately, are the primary health care network for far too many citizens. But for someone that needs to have their temperature taken or needs to have a prescription done, an emergency room is a high dollar expenditure. So with the programs that we have, free clinics, community health centers, prescription assistance programs that we help, we can help individuals and do it at a more affordable cost. So hopefully the downturn won't last too long, and we'll come out of this stronger than ever, and hopefully the healthcare network will be able to withstand the duration.
Well said. Let's hope you're right.
Well, let's hope so. The glass is half full.
There you go. Thank you so much for joining us today, Delegate Hamilton.
Well, thank you, Debbie. I appreciate the opportunity.
We are very fortunate to have such a knowledgeable leader working on behalf of uninsured Virginians. You can find more information about all of these programs at our website, vhcf.org.